Welcome back to I'm Still Here. I'm Larry.
And I'm Heather. In 1998, at the age of 26, I was diagnosed with stage 4 breast cancer. It changed everything for us, but I'm still here.
And we are continuing with the 5 to Thrive series.
Woo!
Woo. I guess.
Well, I feel like, man, we're getting through it. It's been a long
That's
process. The goal. I know. It's been a long process.
It has, yes.
So, we are going to talk about post-treatment phase, and we're going to talk about physical today. Mm-hmm. So, we've been diving into mental, physical, nutrition, medical, and support for all three of the phases. So, if you are not in kind of this post-treatment phase, go back.
Mm-hmm.
You can always go back.
Yeah, so this, what is post-treatment is the question.
Yeah.
It's probably not the day after you're done. That's not what we're thinking here. It's more when you've healed from any surgeries, so you're completely healed from that, or you are to the point where you don't have any of the acute side effects of maybe chemotherapy or radiation that you've gone through. You don't. It's beyond in the treatment phase. It's beyond any of those side effects that you felt. You're, as best we can, label this back to normal. Mm-hmm. And I guess then, obviously, that's a new normal. But that's what we're talking about. That could be a couple of months post-treatment. That could be a couple of years post-treatment that we're talking about today.
Yeah, I think the post-treatment is kind of everything that happens when you're on treatment, a medication that allows you to kind of engage in life, right? Mm-hmm. When you're not so feeling the effects of something. That's just kind of this post-treatment, right? Sometimes you dip back into like treatment phases with surgeries or changes of medication, things like that.
Which you did multiple times.
Which I've done multiple times, yeah. But, in general, it's kind of that time in your life where you're like, okay, how do I meld my life of cancer, living with cancer, and living life, right? Yeah. And not having to have cancer always at the forefront, but also thinking about how it fits in, right?
Mm-hmm. So physically, when we talked about in treatment, you got to be careful, right? With the things you're doing physically, sure. You do. You really need to be careful because of all of the other things in play. And if you compare yourself post-treatment to before you were ever diagnosed, odds are you're not going to necessarily be able to do everything you could do before in this period of your life.
Right. I think physically you're dealing with kind of a new body, for lack of a better term, right? Your body, while it has brought you through, there may be a little bit of a few, what shall I say, scars along the way, right? So things that work and things that don't work as well. And just, I think there's that whole time, when you're going through treatment, you're really just trying to get through. But when you're kind of settling into this post-treatment phase, you're also going, wow, what do I have? What am I working with? Or what, is bothering me? That's the times, when I was noticing, I don't think the feeling is ever going to come back on the back of my arm, having had surgery, or things like, little things like that, but also big things of, I'm going to probably always need to consider, activities that I do because of bone mets.
I was just going to say low impact versus before, sure, let's go play beach volleyball for 3 hours, and it's just...
Yeah.
Some of the things kind of go out the window of those were things I used to do before. And I'm not a metastatic cancer patient, and I can't do the things. So some things are for us age.
Yeah.
Other things are specifically, you just can't do those things.
Yeah, I always kind of say that the first things that I definitely took off the table were skiing, both water skiing and downhill skiing. I can't afford to fall like that anymore. don't feel like I can, right? But some of the things like the sand volleyball, we did play, but then I realized, oh, I need to be careful how I'm doing this or not do it as long.
I mean, you had multiple broken bones from playing beach volleyball.
Multiple. It took a long time. I'm a slow learner sometimes. Yeah. Sometimes the benefit, reward, risk. Some of that was...
Let me be clear. We still won. You know. So
yeah.
she sucked it up for our team, and we got it done.
We were good at it. Part of that, too, though, was just like... one, that was a medication that I was on that led to those fractures in smaller bones, right? Took a long time for me to put all of those pieces together. And sometimes I would go in and get an x-ray for my right foot, and they'd be like, oh, well, your left foot is also broken or has been broken.
Here's another boot.
Exactly. I have both boots. Yeah. So just figuring out kind of, how does my body feel? How does it maybe work best? What can I do? It doesn't mean that you can't challenge yourself. In fact, This is the time really to set some challenges, I think.
I completely agree. You are no longer in the treatment phase. You are, to some extent, getting on with the rest of your life.
Yeah.
And doing that, especially being a metastatic patient, you have to get your immune system as healthy as you possibly can. And physically being strong is huge. Where your weight is huge. You got to get moving, and you got to move often and for a while.
Yeah.
And I get it that it is going to be more difficult for you than the person next to you. Suck it up.
Yeah, I think that's where you just look at, I don't get to compare myself to other people.
Nope, not in this area.
And I feel like it happens so often. You can give yourself an out, but the fact is that's not going to make you stronger, right?
Right.
So you got to figure out how to work with what you have. I don't care if you're in menopause. I don't care if you're this. I don't care if you're that. There's still ways.
Well, I think you don't care because you've been through it all.
Well, I have been. Yeah. And menopause now for over 2 decades I've been in menopause.
Sure.
So, as my friends are coming into it, I'm like, well, welcome. But also suck it up. Let's go.
Yep.
Right?
Right?
And if there's things that you can't deal with or side effects or challenges that you're having, then you do need to work with your doctors. You need to work with professionals to figure those things out because it just can't be an excuse forever, right?
And so often, whether you're doing a YouTube workout in your living room, and so often it's easy to, and we're probably guilty of this too, but you're going along with this and you get to a point where you're just like, I can't do this.
Yeah.
We should never say that. We should modify it. That is the key word with working out and stuff. And if you have challenges because of surgeries you've had or treatments that you've had, modify. But don't not do. Well, don't stop. Don't.
Yeah, and also don't set yourself up for failure. I mean, I'm not a P90X girl anymore.
No. Heck no.
So that's the thing. I think we live in this world of, I used to or I did. No, you don't. You can be really physically fit without killing yourself, No
doubt.
So,
but pushing yourself is a positive thing, and you giving yourself permission to get that heart rate up, to get that breathing up, for extended periods of time, and pushing yourself is okay, just not to a level where you're going to injure yourself, and that is the key. That's where professionals come in. Whether that be a physician, an oncologist, or some sort of athletic professional, a trainer who understands the body, who understands limits, could not recommend more that this is a group thing if you're getting back into it, especially if you're dealing with being overweight. There are specific challenges that come, not only are you dealing with being a metastatic cancer patient, but also the overweight gives other curveballs and issues that are definitely able to be dealt with, but you have to do it intelligently or else injury is going to be a place and you're always going to have those setbacks. And you can have those setbacks even if you're doing everything right. But to do something intelligently, you're going to limit those setbacks and get professional advice.
Yeah, it was really helpful for me. It made me it made me put my life together a little bit. I joined a gym as soon as I was done with radiation, and I worked with somebody to kind of set up a strengthening program, and it added a lot of structure to my days. It made me feel like I was kind of knocking things out, help with the mental aspect of, okay, I'm not in treatment the same way, but all of those things were really, helpful to me.
So when you did that trainer, did they assist in like goals? Like strength goals and conditioning goals?
I told them a little bit of what that my goal was just to be strong and healthy overall.
Oh, that's not a goal, jeez.
But
don't listen to her right now.
No, but that was my overall, what I wanted the outcome to be. But then we set up a program that was very specific. Yeah. And we would then look at that, every, whatever, I don't know, 4 to 6 weeks. I would increase weights as they got easier. Mm-hmm. It was all of that kind of stuff that was happening.
So for everybody, goals cannot be vague. We do it to ourselves because when a goal is vague, we can always say we reached it or didn't reach it, and it's vague. We never really know, and that is true. But goals should not also be. It's not like you're in sports you're trying to win the national championship or what those kind of things. Goals need to be small. Goals need to be achievable. You need to be able to reach them, achieve it, check it, and set a new goal, especially in fitness or physical aspect. Mm-hmm. They need to be achievable goals, and they need to be multiple. And somebody in the physical profession understands when we're talking a difference about cardio goals and strength goals and specific upper body, lower body, whatever we're talking about, flexibility goals, weight loss goals. These things are very specific, and I would just I hope whoever is helping you with this makes them very achievable, because that is big here.
Yeah.
Because you're going to have setbacks.
For sure.
Yeah.
And the other thing is, I think there's a little bit to figuring out how to work towards your goal without overworking sometimes, right?
Yeah.
So one of my latest things is just kind of a check-in with myself I from the 1st to the 5th of every month. So it doesn't have to be on the 1st of the month, but 1st to the 5th. And so I've realized I can run a mile, right?
Yep.
And so
how'd you realize that?
Because I tried it.
You tried it and accomplished it.
And I did it. And it was one of those things that I've been walking a lot lately, over the last
just in case they don't know, why is running a mile difficult for you?
My heart rate tends to go really high
due to
the cardiomyopathy, and
again, this is a side effect of being a patient and dealing with certain medicines, and the side effect of this case has affected your heart and its ability to pump blood.
Right. So, but I was like, I'm just going to see if I can run a mile. This was a few months ago. Mm-hmm. And I started out and I went as slow as I could and still be running. And I was just like, yep. And first, I also walked for like a half a mile.
Sure.
First. That never would have happened in the past. I would have started out running. I would have started out way too fast. I would have been mad at myself, and all of these things would have happened.
Frustrated. Disappointed.
My heart, my breath would have been so out of control that I couldn't do it. So anyway, I did it. And I was like, oh, that's cool. And I looked at, I had kept track of what that time was. And so now I have something measurable that then I ran maybe a couple times, not much. I mean, like maybe twice that next, within that month. And then the next month, I was like, oh, it's the 1st through the 5th. Like, I'm going to run a mile. And my time was down like 25 seconds.
Yeah.
Right? Because again, it's also just me going, okay, I can do this, and I can maintain, I can gain fitness with walking. Mm-hmm. The mile is for me kind of that mental challenge, and also that ability to kind of work on my heart rate and all that kind of stuff.
Because we know our bodies.
Yeah.
We do. No matter, and you don't need the fancy watches or anything to know your body and to back off, or maybe push a little bit back off, and you learn that. And
So my other goal, I mean, just as a kind of a strength goal, is to increase my plank time.
Love it.
Because again, that's kind of just an overall strength, right? And there were times, I mean, even in my post work or post treatment phase, but when I can do a plank for 5 minutes at more, you know, and now I'm like a minute and a half, and it's like, okay,
that's good though.
I can get stronger.
A minute and a half
I
is
can get
great.
better at that.
Yeah.
You know, but so just a couple of like measurable things for me have been helpful in terms of, you know, and like watching my weight, and you know, I'm still working on bringing it down. So, yeah.
So if you're someone that even listening to this pisses you off, because when I'm working with people and starting a workout program, many of the people, the weight is an issue, and everything is harder because of that. So when you're listening to this, go run a mile. Are you kidding me? I can't even. Just that's so outside of anything I can even see. You got to understand that's down the road. That's why I'm saying you set achievable small goals. Walk a mile. Forget a time. Literally accomplish it.
Yeah.
You know, jog the last 50 steps. Can I do that? And if you did, next week jog 55 steps. We're talking about small, achievable weekly and then monthly goals that you can check off the list, and you will see results. And you will see those results week after week, month after month. And it's not the mountain in front of you anymore. It's the little tiny hills that all of a sudden, a year, 2 years, 5 years down the road, you go, wow, look at what I accomplished. When you go, boom, and you look back at what you just did. But people like to put this mountain in front of them, fail on the first climb, and go, I quit, I'm done. And that's why I say you need to get professional help, because not everybody is an expert in this area, just like we're not an expert. I'm not an expert in anything else. But these are the areas that it frustrates me when people do it wrong and either quit because they weren't successful early, or they injure themselves. Those are the two big things that are the big setbacks that you really have to be careful with.
And again, I just want to say too, like when you say run a mile, like I, for a long time, was so embarrassed about my mile time.
Sure.
And it is really slow, but it is, for me, it is you know, I am running and it's a mile. So I don't care. I don't care what other people can do. This is what I do for me. Right. And I so agree with something that really helps me stay on track, and something like with my weight. I've been, you know, thinking about, well, two things. One is, if I looked back on the year 2023 and I lost 10 pounds, I would be happy. I would be proud. That's 10 pounds that I don't have.
No,
right?
Kidding. And so healthy for you.
So, like, it's, sometimes, again, we make these big goals in our head and we get pissed off when we don't. But you know what? I'd be so, like, just being happy with that makes a difference. The other thing is, I have lost around that weight, right? My blood pressure was down considerably with that. And I was like, just with that? Yeah. And Dr. Mariah was like, yeah. Like, it's amazing how quickly our body can respond to, you know, even some, what I would consider small changes, right? So, yeah.
Okay, one more thing. To the person that's listening, that's frustrated even listening to this. Don't run.
Yeah. Oh, God, no.
Running sucks. I hate running.
Yeah.
I've tried to wipe running off the earth from what I do. There are other things you can do.
Absolutely.
You know, if running is horrible because weight is an issue, find a pool. Yeah. Swim. One of the healthiest things you can possibly do, does not have the damage to the joints and the stress in doing that. Ride a stationary bike, row on a machine. There are many, many, many different things. I know we say running because it just pops into our head, or walking. And that's something we enjoy and we do.
For us, it's easily accessible, right? Yeah. I can run regardless of where I am.
We don't have to buy any equipment.
No equipment. It's free.
But I do know that many people despise running,
And that's
and
fine.
it is horrible for your lower body joints. Of all of the exercises we can throw out there, when we talk about injuries, especially to knees and ankles and hips, it is running. Running is the cause of most of those. So biomechanically, as far as a recommendation goes for things that people should be doing, running is not on my list. It does nothing but injure people, to be honest with you. So you really gotta be careful in the stresses. Again, especially if you're carrying an extra 10, 20, 150, whatever those pounds are, you got to be careful with that.
Yeah.
I forgot to say that.
Okay.
Sorry.
The other thing I was just going to say is, like, again, I am constantly reevaluating what works for me, right?
Mm-hmm. Me too.
And I think it's always just the never give up kind of thing, or do it differently, or whatever. It's today I went for a walk this morning, like in the morning time. I don't think that I feel as good in the morning. Like, I think, like, I think I kind of like my walks go a little better in the afternoon, but I love that getting them done in the morning is one, it kind of bolsters me for the whole day.
That was me this morning. I was in a depression. I was just like, oh my, I can't, it's Monday, are you kidding? And worked out for an hour and could not have had a different mindset on the day. Mm-hmm. And the last thing I wanted to do was exercise at 8:00 this morning, but I did it.
Yeah. Well, I mean, not only that, like, I literally found myself today going for a walk, and I was making a deal with myself. Just go up and around.
Love it.
Just go up and around. And then as soon as I got to where I said I could turn, I was like, no, I'm fine. And I did my normal route, So again, just.
And, okay, here's the next part. And we actually don't even have it on the list. Get a workout partner. Yeah. You know how we talked about, going through treatment and having all of the support and stuff? The support doesn't have to end. And it doesn't have to be somebody who's the same as you. No. It doesn't have to be somebody who's better than you, worse than you, anything. It has to be somebody that has the best ability, and that is availability. They need to be available to do that. Yeah. We walk together, and it's awesome for both of us. It's not as fun doing it alone.
No, it's not. And I loved it. I mean,
and you can do, because of podcasts and talking, and you do all that.
Yeah, but I love to walk with my friends. Like,
Mm-hmm.
that's one of my favorite activities to do with my friends, is to meet them to go for a walk.
Yeah.
So, I just I would rather do that than get a cup of coffee,
Yeah, so, right. And I think we had talked about, not in the series, not a 5 to Thrive, but if you go back many moons on podcasts, I talked about being accountable. And that can be a workout partner. Yeah. Like, we're accountable to each other, and hey, you want to go for a walk and that kind of thing. And you're likely to do it if somebody invites you, type of thing. It doesn't have to be somebody to necessarily work out with you.
Right.
But I think you do. If you say, this is my goal, and these are the things I want to do to achieve it, and that can be through help. Like, you get a fitness person to help you design this plan. Then find somebody to be accountable for. Mm-hmm. Or two. To be accountable to. And they can be accountable to you too. Whether that's working out with you, and when I say working out, that can be anything. But it's a check-in that I got this done today, and it goes with that checklist we had talked about before too.
Yeah. I just think it's really easy in cancer to look at all the things that are being done to you, and to be, it's also really easy for people to be fix me type of people, and it's not helpful to be a fix me person. I think to always be willing to say, what can I do? How can I be better? It doesn't mean that you're not happy with who you are. I think it's always that we're made to grow and to strive, right? Yeah. Our bodies are not made to be sitting on couches forever. We're made to move, all that kind of stuff. So,
because what's our goal here? Our goal is to have an immune system that works the best possible.
And
because immune systems kill cancer.
Absolutely. And I also always think about it like, these are the days that I was hoping for. These are the days that I wanted. A day that I could go and be physical, like I
Yeah.
could do something physical. That's what I was hoping to have. And so to be able to think about it in that way, to be able to be grateful for the fact that I can move my body and I can, live this life as fully as possible. That's what I was hoping for.
Yeah, for sure.
All right. Next week we're back. We're going to talk about nutrition.